Each year, skin cancer is among America's most common form of cancer, and there are small steps you can take to help prevent it. I am now with Jennifer Miller from Anthem Medicaid and Ashley Teague from Kentucky Cancer Program. Thanks for being with me, ladies.
Yeah, happy to be here.
So when we hear skin cancer, we hear melanoma. So what exactly is melanoma?
So melanoma is actually an overgrowth of abnormal skin cells. So it is not the most common type of skin cancer, but it is the most serious because of how quickly it spreads.
And what are some symptoms of melanoma to watch out for?
So those are going to be the A, B, C, D, E's. You're going to look for A, asymmetry. Is your mole symmetrical? B, border. Is the border jagged? C, color. Is the color dark? D, diameter. Is it larger than the size of a pea? And E is for evolving. Is it getting bigger?
Now, how can Kentuckians minimize the risk of melanoma?
There is a bunch of different ways, starting with staying out of the sun during midday hours, and that is between 10 a.m. and 4 p.m. because that is when the UV rays are the strongest. Also wearing sun protective clothing, sunglasses, hats, wearing an SPF of at least 30, and the biggest one, avoiding tanning beds and sunbathing.
I mean, people have regular moles, but how often should you get checked and screened for skin cancer?
So you should always be looking at your own body. Like you said, we all have moles. We know where those moles are. If you notice changes, let your doctor know. Also, it would be a good idea to have your doctor check you annually just so that they can keep an eye on suspicious places.
Now, what age should we start to be proactive and get these screenings?
So there isn't really a specific age. It kind of depends on your family history. Otherwise, between 20s and 30s.
Now you have this here. What is this exactly? I'm looking at all the different skin pathology.
Yeah, it's a little overwhelming to look at, but it's showing you what some moles can look like and if those are maybe precancerous or cancerous. So you can look, is that something that I have on me? Oh, maybe that's something I need to go get checked.
And obviously, one of the things that we probably need to do is wear sunscreen, correct?
Yes, at least 30 SPF.
All right, well, thank you so much, ladies. Remember your A, B, C, D, and E in order to be more educated about skin cancer. This has been Martina with Everyday Kentucky. We'll be back with more right after this.